Hi, I'm Dr. Allen from Jones Animal Hospital. Thanks for watching Vet Visits. Today we're going to talk about heart disease. A lot of people don't realize that dogs can get many of the same heart problems that people can, and congestive heart failure or mitral valve disease is a fairly common thing to see in pets, dogs especially, as they age. Now it's primarily a small dog problem, although larger dogs can get that as well. And many times we'll have dogs on a lot of the same medications that their owners are on. Diuretics to help keep fluid from accumulating in the lungs, medications to improve the strength of the contractions of the heart, medications to lower the blood pressure to make it easier for the heart to pump the blood. A lot of the same things that their owners are on or other people are on, we'll have our pets on. So what do you see if you have a dog that's beginning to develop congestive heart failure? Well, very often the first thing people notice is a soft cough, sometimes a little shortness of breath. If they're paying very close attention, they'll notice a little increase in the respiratory rate, how many breaths per minute the dog's taking. And all of these are signs that some fluid is beginning to accumulate in the lungs, a problem called pulmonary edema. And that's very often the very first thing we see with dogs that have heart disease. So if you begin to see things like that, a little soft cough, especially in an older patient, shortness of breath, they can't go up the stairs like they used to could, they're breathing a little more rapidly, even at rest than is normal, that's a good time to have your dog checked by your veterinarian. So what the first thing they'll do is they'll do a good physical exam, listen to the dog's chest with a stethoscope where they can evaluate if there's a heart murmur, kind of the rate and the rhythm. Can listen to the lungs, listening for any kind of what they call crackles or any signs of fluid in the chest. They'll actually watch your pet breathe, how much respiratory effort they're having. Those are all things we can see on a good physical examination. Also, your veterinarian may very well want to take a set of chest x-rays. With the chest x-rays, they can look at the size and shape of the heart. They can assess if there is fluid starting to accumulate within the lungs. Also look for other potential problems. Sometimes we'll have a dog we think has heart disease that winds up having a mass in its chest, or a hernia, or some other problem that we didn't suspect without taking the chest x-rays. Sometimes we'll also refer dogs to a veterinarian who can do an echocardiogram, where a plain x-ray just looks at the size and general shape of the heart. An echocardiogram can actually look inside the heart, look at the size of the chambers, the thickness of the heart muscle itself, what's called the ejection volume or fraction, how much blood is actually being pumped each time. Can also look at the valves to see if there's signs of degenerative valvular disease, which dogs get just like people can. And once that information is gathered, a very good assessment can be made about what level or stage of heart disease your dog has and what the medications are that are going to be most appropriate to help treat that. Something we always tell people when we first diagnose a dog with heart disease is this is a problem that we can't cure. Heart disease is never cured, but it can be managed. And in many cases, it can be managed very successfully for months, sometimes even for years, and have the dog have a very good quality of life, as long as they're checked regularly and kept on their medications. So heart disease is something we see in dogs. Occasionally in cats, but more of a dog problem, and mostly a small dog problem. Oftentimes, coughing and shortness of breath is the first thing the owners notice. The veterinarians will often do a physical exam and x-rays, sometimes an EKG or an echocardiogram to get further information and get them on appropriate medicine. But with appropriate medication, consistently given the rest of the dog's life, in most cases, almost all cases actually, many times, most of the time, heart disease can be managed effectively. So just because your dog has congestive heart failure or congestive heart disease, that doesn't mean necessarily that the end is near. Most of the time these can be managed and usually pretty successfully. Hope this has been useful. I'm Dr. Allen from Jones Animal Hospital. Thanks for watching Vet Visits.